Hello. In this chapter, chapter 7, we're going to look at the skeleton, the bones, and the joints. When looking at the general overview, we're going to look at the fact that the skeleton has two skeletons, the axial skeleton and the appendicular skeleton. We're going to look a little bit about the anatomy of bones. We are going to look at ossification and generally bone formation and reabsorption and the role of the clast and the blast. A little bit on the bones themselves. We are going to get just briefly into disorders, and we will look at joints and how joints work with movement. First off, these are the bones that I would like you to be aware of. Please realize there are many different bones in the foot and the ankle. We're just calling them metatarsals and tarsals. Also, the cranium, which is the skull, is made up of a series of bones. I want you to be aware of them, but you don't need to know the name of them. When you're looking at the bones, look at the shape of them and what is attached or what articulates or moves beside which. Okay. The whole function of bones is to act as a framework for the body. It's to protect the delicate structures, such main ones are your ribs and your heart. By your your ribs will protect your lungs and your heart. Your brain is protected by your cranium, and your spinal cord is protected by your vertebrae. The bones work as levers to produce movement. Your bones are also excellent storage of calcium, which will come in when you look at aging and osteoporosis. In older women usually, and also the bones are the location for blood cell production, which we'll get into more detail when we do the blood unit. When you look at the structure of a bone, and this is a long bone, this is actually the femur, you can tell by this head here. I want you to be aware of something called the periosteum, which goes around, and this is connective tissue around. Then you have your endosteum. Osteum is a word for bone. Endo means in, peri means around. Now, the bone itself has two types of cells in it. You have spongy bone, which is on the outside, and then compact bone, which is stronger, and that goes towards the sort of on the main part of the shaft. Also, most bones have a cartilaginous cap on them to help with articulation and decrease friction in movement. Then there is something called the epiphyseal line, or sometimes it's called the epiphyseal plate. You know how people will dig up bones and go, oh, this is the bone of a child? That's because this is where the growth plate takes place. As the bones age, or the organism ages, these bones start to fuse and no longer become a plate, but become a line of growth, or just a growth line. Okay, when you look at bones, it's not solid all the way through. It's sort of like a bunch of straws holding it together. You don't need to know all these individual words, but be aware of the fact that they are canals of bone, rings of bone with a canal in the middle. Inside the canal is where your blood vessels run. The blood vessels also connect to the outside of the bone, which is covered by the periosteum, which is connective tissue used for protection. Okay, you have in the medullary cavity is where you have the majority of this spongy bone. Good. Now, when you look at bone growth occurs at the epiphyseal plate. Then there's also words in terms of bones can be reabsorbed. The whole idea of why braces work is you're putting pressure on the tooth, by moving the tooth, you put pressure on the bone breaks down in that area and it reforms behind it. The cells that break down or reabsorb bones are called osteoclasts, and ones that build are called osteoblasts. And an osteocyte is just another word for a bone cell. When you look at ossification, This is the conversion of cartilage to bone. During the developmental stage, the bones are all outlined initially as cartilage, and then as the fetus develops, that cartilage is replaced by the bone mineral. Okay. Next, when you look at the head, the cranium, there are sinuses inside the cranium. This is, they help with pressure. They also help with breathing. Now, some bone markings. You have a head. You have processes, and processes can be condyles. Condyle is something that it articulates on. You have a crest. Example of that is the iliac crest, which is the outside part of your hip bone. So if we look at the hips, here's your ilium. Your iliac crest is this line here. Then you also look at the other bone words I want you to be aware of. Just a second, I've lost that list again. Crest, spine. The spine is a large ridge, and if you look on the scapula, which isn't, the back isn't shown here, there is a spine, the spine on the scapula, which is usually for muscle attachments. Then you have foramen. Foramen is another word for opening. The ocular foramen go around the eyes. You have the big hole which goes into your skull is the foramen magnum. Then you have a fossa. Fossas are more of dips. And then you have a medius. Medius are more of channels. And the medius, the most common medius is your auditory medius, which is your ear hole right here as it goes into the bone. Okay, those are bone words. Just to look at the skull, you have the axial and the appendicular skull. Your axial skeleton is here in yellow. Your axial skeleton refers to the cranium. It refers to the vertebrae around the backbone. You have your ribs with your sternum. Also, inside your ear, you have three little bones called ostium. Or ossicles. Those are they're also part of your axial skeleton. When you look at your appendicular skeleton, which is blue here, the appendicular skeleton have to do with the appendages. And you're looking at the pectoral girdle, which is the clavicle and scapula. Then you have the pectoral girdle, which is the hips. Okay, I just want you to be aware of the skull. The skull is 9 different bones in your skull. And these 9 bones are not fused until late in birth. And that is because the skull has to have some give way as it goes through the birth canal. Realize there's a lot of different bones here, and most of them are labeled relative to the lobe they cover. I just want you to be aware of them. You'll learn more names later on. Oh, I talked about the foramen magnum. Here is a foramen is a big hole, and magnum means large. So the big hole in the bottom of your skull, this is where your spinal cord comes out to join to the rest. Okay. Here you can see that when it comes to naming the bones, it's sort of related to the lobes of the brain. The frontal bone is above the frontal lobe. Then you have the parietal, temporal, occipital. Just to be aware. Now, you may have noticed in an infant you have what's called the soft spot. And the soft spot is just before the bones of the bones fuse as you're an adult, but in a baby they do not fuse. They're not fused yet, so this way there is some squishiness to the head as it comes out of the birth canal. Good. Axial skeleton, very important. You need to know the vertebrae, and you need to know the groups of vertebrae in order. You have the the atlas, which is on the top. It's your first cervical, and alphabetically it comes before the axis. The atlas goes up and down. The axis goes side to side. Then you have your seven cervical vertebrae, 12 thoracic. Then you have your 5 lumbar and your fused sacrum, and then you have your coccyx or your coccygeal vertebrae. Very important that you learn these in order, and how many in each, please. I just want you to be aware that the vertebrae have processes on them. You don't need to know the process at this time, but you need to realize there's processes and spines, things that stick out. Usually when you have something that sticks out, it's to limit motion, which is what's happening here, or for muscle attachment. And if you've ever eaten a chicken neck or a turkey neck, you will see that there's a bunch of muscles attached to this. And if you haven't, go buy a whole turkey or a chicken and look at it. Also, as you travel down the vertebrae, the shape of the vertebrae change a little, just in terms of the size of the spines. Then when you look at the sternum, you have ribs, and you have true ribs, and then you have false ribs or floating ribs. Notice that most of the ribs, the first 5 ribs, have their own attachment, and then you have cartilage for it attached to the sternum. And the sternum has this xiphoid process at the bottom. It's a point of muscle attachment, but also you need to be very careful when giving CPR or when doing any sort of chest thrusting that you do not break off this process and puncture a lung. When you look down, then you have, so these are true ribs. They have one attachment. Then you have the false ribs, which all kind of attach to one process and then hit the bottom of the sternum. Also, you have false ribs, which are on the back. They're there, but they don't come all the way around to join the front. Okay, then when you look at the appendicular skeleton are the arms and the legs and the girdles. I want you to be aware of the names of them. I also want you to be, the acromion process is used for marking. It is on the end of your scapula. Also, here is that spine. We talked about it. So you have the supraspinatus muscle is actually above the spine, super, and you have the infraspinatus muscle, which comes below the spine. Okay. You also have a glenoid cavity. The glenoid cavity is where the scapula will articulate with the humerus. In the legs, you have your your tuberosities, which are, oops, that's not the legs, that's the arms. Quite often we talk about anatomical position, and anatomical position is when the hand is up. This is why you do things in anatomical position, because the radius is on the medial side of, no, that's lateral side of the arm. And when you rotate your hand and flip your hand to the prone position, you will cross this over. The way I remember supine is it has the word up in it, and also you could hold a bowl of soup, supine. Okay? Again, I want you to realize how the bones are shaped so they fit and articulate with each other. We're not going to get into too much detail as to the naming of each of these processes. When you look at the pelvic region, the female pelvis is larger, so the baby's head can fit through there, and it is wider. This is why women normally have wider hips. I am getting to the end of this, and I haven't talked much about it. I haven't talked about joints yet, so I will do a separate video on joints and movement. So this is just part 1. And I will have a part 2 because I got excited about talking about bones. So enjoy your bones.